Welcome to this podcast from the Medical Journal of Australia. My name is Sally Block, the MJA's news and online editor. Today we'll be talking about gastric and esophageal cancer and what we have learnt about it as a community. This podcast is sponsored by the PanCare Foundation and funded by the Australian Government. The PanCare Foundation provides support to people impacted by a diagnosis of upper gastrointestinal cancer. The views expressed in this podcast do not necessarily represent the views of the PanCare Foundation. My special guests are Melanie, Regan and Sue Hegarty. Melanie has 3 decades of cancer nursing experience across clinical, policy, program management and research settings and now works with PanCare. Sue has a 28-year history as a cancer nurse. She is Head of Program Development and Advocacy at PanCare. These questions are for you, Melanie. Can you explain the role of PanCare and the support that you provide to people affected by gastric and esophageal cancer?
Yes, thank you. The PanCare Foundation are a charity, a not-for-profit organisation that provides information and support for anyone in Australia impacted by upper gastrointestinal cancer. We are here for people and their loved ones who experience cancer of the stomach, esophagus, bile ducts, pancreas or liver. Each year in Australia, over 13,000 people are diagnosed with an upper gastrointestinal cancer, and sadly, these 5 cancers are amongst the lowest survival cancers across the board. We have a website, pancare.org.au, that has information about the 5 different types of cancer, about being diagnosed, having tests, being treated, and coping with cancer. On our website, you can order information to be sent to you in the form of one of our My Care kits. These kits are small folders with information about each of the types of cancer, about managing eating, and many other aspects of living with one of these cancers. Like all of PanCare's services, these kits are free for everybody. PanCare Foundation also manages a telehealth service. We have care coordinators, specialist nurses, and counsellors who are available for appointments to discuss whatever people's needs are and provide help and support. The service is free and confidential. We have no waiting lists, and there is not a limit to our service. The discussions are over the phone, so we can help anyone across anywhere in Australia. People can book through our website or ring 1300 881 698. During the telehealth calls, people or their loved ones can talk about being diagnosed, their side effects. They can get information that they need, learn about what they are going through, get help navigating the healthcare system, and receive counselling. A common conversation our telehealth staff have with people impacted by stomach and esophageal cancer is about weight loss and diet, and we often refer people to specialist dietitians.
What do we know about the psychosocial impact of a diagnosis of gastric and esophageal cancer?
People diagnosed with gastric, or stomach cancer as it's known, or esophageal cancer face difficulties such as being diagnosed late, as these cancers can be vague with their symptoms. Then treatments are hard. Surgery, chemotherapy and radiotherapy have a lot of side effects. Add that to the poor survival rates, and it's easy to understand why these illnesses can take a big toll on people's psychological and social well-being, as well as that of their family and friends. At least 50% of patients experience significant anxiety, and 80% of carers experience significant anxiety. Cancers that grow in parts of the digestive system have a big impact on everyday life. Many people are unable to eat and enjoy food in the same way as before the cancer. This can lead to losing weight and losing quality of life. Over 70% of people with esophageal cancer experience debilitating weight loss. All patients need to be able to have access to and see a dietitian to help them through this time. Being able to talk to a counsellor is also important, as life has changed so much and getting help with the adjustment is vital. Caring for someone having this experience is equally difficult, and talking to a PanCare nurse and counsellor may help.
What initiatives do government currently have in place to improve outcomes for people with esophageal and gastric cancer?
The Australian Government released the Australian Cancer Plan at the end of last year. It is a plan to continue to improve outcomes for all people with cancer in Australia. The PanCare Foundation are grateful for receiving funding from the government to provide the support from our nurses and counsellors. We have also been funded to create education and awareness of stomach and esophageal cancer. We have an online education module for GPs to complete to assist with diagnosing people earlier, as we know that can improve survival. We will have a campaign in November to raise awareness in people who might have symptoms such as difficulty swallowing, pain in their stomach, heartburn that does not improve, to go to their doctor. The government has also funded the PanCare Foundation to create an area on our website to have a range of fact sheets, videos and webinars that will help people who need diet support while experiencing an upper gastrointestinal cancer, such as stomach and esophageal cancers.
And these questions for you, Sue. PanCare recently launched the State of the Nation for Upper GI Cancers. What are the main priorities identified for improving survival of gastric and esophageal cancer?
Yes, PanCare Foundation led the development of the State of the Nation into upper GI cancers in collaboration with the sector. So that's all the clinicians and the people impacted by the disease. It's the first of its kind report offering an in-depth analysis of the challenges across the cancer continuum. The report provides a framework for action and will improve the lives of those living with upper GI cancer, both today and into the future. It really does demonstrate the dire need for policy reform and investments to reduce the incidence and improve the quality of life for patients and their carers. Critically, it outlines priority areas for research investment that can improve for survival. We know, unfortunately, for far too long, upper GI cancers have witnessed little progress. Conversely, other cancers have observed improved outcomes in survival as a direct result of increased awareness, early detection and improved treatments, underpinned by strategic investment and collaborative action. Unfortunately, we know that more than 23,000 deaths due to esophageal cancer and more than 30,000 deaths due to stomach cancer will occur from 2022 to 2035. So we know together as a community we must take urgent action to address the unmet needs of patients and their families and work in partnership with governments to develop long-term solutions. Now is the time to take action. The report outlines opportunities to improve outcomes for people living with an upper GI cancer and their families. While there are major challenges to be overcome, there is good reason for hope. Significant opportunities are available to substantially reduce the incidence of gastric and esophageal cancer, which can improve survival and quality of life through policy actions, investment in medical research. We know that the evidence in the report shows there's some really big opportunities to improve outcomes through primary prevention. We also know there's opportunities to improve survival in the short term through earlier detection and improved adherence to clinical best practice guidelines that exist today. We also know there's opportunities to improve the system to support referrals to appropriate services and service reform. For example, we know that evidence shows that the 5-year survival rate for gastric and esophageal patients treated at high-volume hospitals is between 10 and 60% higher than those treated at low-volume health services. We know there are opportunities to improve quality of life and health service utilisation through the empowerment and support of consumers to navigate the right support when they need it. Most significantly, we know that delivering significant breakthroughs in treatment and care through a nationally coordinated approach to research across a range of domains to address disparities in survival outcomes. PanCare Foundation and the sector are calling on the Australian Government for a 10-year upper GI cancer research mission. We know that would provide the core enabling infrastructure and coordination of the wider research community around shared research priorities needed to deliver a step change in improving outcomes for people with upper GI cancers.
Can you explain the importance of clinical trials for people with gastric and esophageal cancer?
Thanks, Sally. Unfortunately, we know the 5-year survival rates remain really low for people with gastric cancer. They're just 38%, and esophageal cancer just 23%. So what that means is most people won't be cured by standard treatments alone. We know that clinical trials present an opportunity to access novel treatments in a setting of high-quality care. We know from our survey that we conducted as part of the State of the Nation that 54% of people with esophageal cancer reported that trials were not raised. The State of the Nation report highlights that Indigenous Australians, rural patients, culturally and linguistically diverse, and those with low health literacy have reduced access to clinical trials and are less empowered to obtain best practice treatment. The report also highlights that a common frustration for patients is that international trials available for upper GI cancer patients are frequently not available in Australia. The State of the Nation report highlights the need for clinical trials as a standard of care. PanCare Foundation is working very closely with Omico, a not-for-profit, who aims to increase access to genomic profiling to detect unique genetic variations in cancer patients' tumours to identify potential matches to new targeted treatment options. They're growing and streamlining biomarker-led clinical trials by expediting patient recruitment and site setup and attracting more international trials to Australia, facilitating faster transactions from discovery to clinical application, advancing a research-led model of care as to open new treatment pathways for patients, and supporting drug development and cancer research through the collection of real-world data. We're really committed to seeing that every eligible Australian with upper GI cancer gains access to genomic profiling.
What role does the Upper GI Cancer Registry play for improving outcomes for people with gastric and esophageal cancer?
Thanks so much, Sally. We're really lucky in Australia that the registry for upper GI cancers was established in 2015. It's led by Professor John Zalzberg at Monash University and forms an unparalleled real-world data set that can be used to explore current patterns of care through the collection of data on the diagnosis, treatment and outcomes of people with upper GI cancer. The registry is designed with the intent to systematically measure quality of care, assess compliance with national and international guidelines, and ultimately drive improved outcomes for patients. As we discussed today, whilst research and clinical trials are needed to identify more effective treatments, and we know this is happening globally, in the short term, it's critical for all clinicians to focus on improving and maximising quality of care based on existing evidence-based guidelines. This fundamental approach is part of the ongoing challenge to improve outcomes for patients diagnosed with upper GI cancer. Indeed, even as new treatments are discovered, it's critical that these are compared to current best practice standards, driven by clinical registries such as the Upper GI Cancer Registry.
My special guests have been Melanie, Regan and Sue Hegarty. This podcast is sponsored by the PanCare Foundation and funded by the Australian Government. The PanCare Foundation provides support for people impacted by a diagnosis of upper gastrointestinal cancer. The views expressed in this podcast do not necessarily represent the views of the PanCare Foundation. You can find more podcasts at our website at mja.com.au or wherever you get your podcasts. Thank you so much for listening.